Many people are trying to lose weight as they're worried it could make things worse for them if they get COVID-19. To discuss the links between obesity and the virus, I'm joined by Sundeep Ruder, a clinical endocrinologist and member of the Society for Endocrinology, Metabolism and Diabetes of South Africa. Very good evening to you. Let's first tackle the rather disturbing news that obesity amongst adults is on the increase. What's going wrong there?
Good evening, Jane, and to the viewers. It's a fact. We've seen the global prevalence of obesity increasing over years, even before COVID hit us. I think we were less aware of it. I think there are many driving factors for this. Certainly Southern Africa and South Africa has been affected too. We're looking at global rates of diabetes of prevalence currently sitting around 650 million people known with obesity. Wow. And in South Africa, the numbers are very high, with a lot more women than men being affected. So certainly the prevalence going up, and I think what needs to be thought about is what are the driving factors, and it still comes back to unhealthy diets, unfortunately, lack of regular exercise, stress plays a big role, and then other contributory factors like alcohol consumption and cigarette smoking even, which are all being highlighted now and amplified in this COVID pandemic, as well as themes to discuss and learn from, I suppose.
All right, you say that growing numbers of women are getting this. What about certain groups? Are you identifying those who are more vulnerable to obesity, to getting it?
Yes, definitely, Jane. I mean, like I said, even before the COVID pandemic, we were aware, and studies have shown that certain ethnic groups are more prone to developing obesity. Numbers in the USA show that non-Hispanic black patients tend to have higher rates of obesity, and that's been shown around the world as well when we look at figures. The reasons for these may be multifactorial, they may be small genetic issues, but largely we're seeing socioeconomic differences, poverty and environmental issues playing a role in that as well. So other than the individual, the environmental aspects also need to be addressed in terms of socioeconomics, food access, poverty, inequalities, etc. as well.
Sundeep, winter's on its way. Well, it felt like winter was certainly here this morning. We know that a lot of people comfort eat. They often turn to sugar when they are cold and they're trying to get some warmth into their bodies and into their homes. What sort of impact is that likely to have, knowing that the third wave is well on its way?
Yeah, it's an interesting concept, Jane, that how we cope with stress is unfortunately going to things that comfort us. And it's a discussion we're having in academic meetings as well, because a lot of our obesity measures in terms of pharmacotherapy and short-term dietary and exercise intervention seem to fail, because long-term patients are not able to manage stress very well of any kind, whether it's a crisis like COVID or not. So stress, defined as a mental agitation due to unfulfilled or interrupted desires, leads to that agitated feeling, and for comfort we may reach for food or a cigarette or a drink. And it may give a temporary satiation or cessation of that agitation, but in the long term it drives the obesity, and we've previously spoken on this platform on diabetes as well.
Okay, so, other than being abstemious, excuse me jumping in here, what can people do? And if you feel that you may have diabetes and you're suffering, what should you do?
I think now is an important time to be aware of those drivers. We've seen in our clinics an increase in patients' weights and worsening of glucose control. So if you are overweight or do have obesity, it's important to get your glucose screened at your clinic or your GP. I think that's still possible. Don't be afraid to connect with them. I think it's a nice time to standardize routine at home rather than get out of routine. So look at getting your 1 hour exercise per day, look at cooking meals with fresh food, try and avoid the processed food, and look at ways of keeping the mind active with purposeful behavior that grows you rather than brings you down. And that requires a deeper discussion, of course, but there are a lot of online platforms and other ways to access ways of doing that as well.
And I should imagine that these conversations should start with children at schools, in your own families, and if we don't tackle that at a young age, it's going to have a devastating impact on our hospitals.
Absolutely. We need to look at time cause and cause effect. Certainly a recent academic meeting we attended looking at data that mothers who have obesity, having children when they're obese, those children have a 234% higher odds of developing obesity and a 3.5 times more likely chance of developing diabetes. So that's why I think we're emphasizing that maternal health is very important, the child bearers of society. We need to look at preventing obesity in mums first, and then also looking at childhood nutrition when they're very easily influenced. So programming and marketing of children's minds as to what is correct. And also developing critical thinking and a good relationship with food for kids is a very important part, and that requires families and communities to come together for that as well. Government needs to play a big role. So lots needs to be done in this space, I think.
Okay, and I'm sure it gets a little bit worse, or possibly a lot worse over weekends. I appreciate you speaking to us on this Friday evening, Sundeep Ruder.